Hi, Zach. Today I'm going to be doing an assessment of your heart, your lungs, and your blood vessels. So I'm basically just going to listen to a couple of things and I'm going to feel your pulses. Is that okay with you?
Okay.
Alrighty. And for this assessment, my patient has decided to keep his shirt on. If we were in a different setting, I would have the patient remove their shirt for this. Alrighty. So just go ahead and relax for me. How are you doing today?
Doing pretty good. How about you?
Good, I'm doing good too. You're doing great. Just keep on relaxing. Are you feeling okay?
Yeah.
Alrighty. Are you having any pain anywhere?
No.
No, okay. Alrighty, go ahead and relax your head back a little bit for me. I know there's no pillow there, so I'll kind of give you a little leverage. At this point, then I would assess Zach's femoral pulses too, and make sure that those were um, equal and the pulses were good. So go ahead and bend this knee up a little bit for me. Good, and just relax your knee. Are you feeling any numbness in your fingers or toes?
No.
So go ahead and extend this leg out for me. And I am gonna have you go ahead and flex this foot. I'm gonna lift it off the bed a little bit. You feeling any pain back here?
No.
No, okay, good. Do you have any pain in your legs for when you walk or if you stand for long periods of time?
No.
No, okay. What do you do, Zach? What's your job?
I'm a police officer.
Okay, so are you on your feet a lot? Quite of the day, or?
No, not really. I'm usually typing a lot of reports in an office.
Okay.
Majority of the day.
And go ahead and bend this knee up too. Do you have any questions about your circulation? Is there anything that that seems to be bothering you?
No.
No? Okay. At this time, I would then feel Zach's other femoral pulse. And you said no numbness in your fingers or your toes, correct?
That's correct.
Okay. Alrighty, Zach. And now I'm going to move on to do basically your chest assessment. So I'm going to listen to your heart and your lungs and just kind of palpate and percuss things. And again, for this assessment, Zach has decided to keep his shirt on. If I was in a different situation, I would ask the patient to then remove their shirt, put a gown on, so I would be able to palpate and inspect their bare skin. you been having any issues with your heart? Any like racing heart, or do you feel like your heart's skipping a beat?
No.
No.
No issues.
Okay. Do you have a history of a like a heart murmur or any chest pain or anything like that?
No.
No?
No issues.
Just go ahead and breathe normal for me. So I was listening at this point at the aortic. Over here is the pulmonic. I have the herbs point. I have the tricuspid. And I have the mitral. This is also the apex of the heart. Good. I'm going to listen for if you have any murmurs, Zach, okay?
Okay.
Again, I'm going to listen to the aortic, pulmonic, the herbs point, the tricuspid, and the mitral. Good. All right, Zach, go ahead and lean your head back a little bit. I'll put my hand here as if a pillow were here, and look over the shoulder for me. Good. Okay. Zach, now after I just listened to your heart, now I'm going to move on and listen to your lungs, okay? So during this assessment, I just want you to take a couple of deep breaths and just breathe normal for me, but I'll tell you when to take deep breaths, okay? So, actually, if you can move to the side of the bed and sit to the side. Perfect. In a normal setting, I wouldn't typically get behind the patient, but for this video, I am going to get behind the patient so that I can see. All right, Zach, go ahead and lean forward for me and cross your arms in front of you like you're giving yourself a hug, okay? Take a couple of deep breaths for me. You're doing great. Couple more deep breaths. Great. All right, you can just breathe normal for me. And Zach, at different points, I want you to say the word blue balloon, okay?
Okay.
So I'll go ahead and tell you when. Alrighty, go ahead.
Blue balloon.
Go ahead.
Blue balloon.
Go ahead.
Blue balloon.
Go ahead.
Blue balloon.
Great. All right, Zach. Take a nice deep breath for me. can you go ahead and put this arm up over your head? Perfect. And just take a couple deep breaths, okay? Great. Alrighty, I'm gonna have you do that to this side. Great. Okay, you can go ahead and put that down. Zach, if you wouldn't mind putting your legs back up on the bed for me. And if you can, just sit normal. I mean, don't lean back. Just take a couple deep breaths. Alrighty. Go ahead and tip your chin back for me a little bit. Okay. And I'm sorry to do this again, but can you go ahead and sit on the side of the bed for me? Alright, go ahead and take some deep breaths for me. Are you having any issues with your breathing? Any concerns that you can think of?
No.
Okay. Okay. And that go ahead and completes our assessment for your heart, lungs, and blood vessels.
Okay.